Welcome to the gun show.
Wow, look at
Welcome back. It's a great day, and welcome back to the desk. Oh, I think welcome back to the desk because she's about to inflict some pain.
Wow.
Not really. We're talking,
Not
of course.
really.
No. We're talking about Medicap Pharmacy.
Don't
Sherry
get to
Schmidt
see
is
the guns
here.
very often.
And it is that time of year, a time of year that's very important. It's flu shot time of year. And first of all, before we roll our sleeves up, why is it so important to get a flu shot?
Everyone, the CDC recommends everyone 6 months and older get a flu shot. So the influenza is one of the most preventable diseases that there is, causes illness every year. We know that there will be thousands of Americans that die, are hospitalized, get complications from it. And it's really important. We have a lot of people that come in and they'll say, well, I never get sick, so I'm not going to get a flu shot. But it's not just about you. We need to have everyone get vaccinated to protect those around who can't get vaccinated or who don't build a good immune response from it.
But Sherry, if I get a flu shot, I'm going to get sick. I don't want to get sick. You hear that a lot.
I do hear that, yes, which is also another myth. So the flu vaccine is, in the injection anyway, is an inactivated virus, and so it can't give you the flu.
You cannot get sick from getting a flu shot.
You cannot get the flu. You can get, maybe feeling redness, soreness in the arm. Some people just feel a little bit in general, like kind of, they describe as maybe off, a little bit fatigued, not feeling 100%, but it will not give you influenza.
Okay.
So.
Now, the last couple of years, we've had some nasty bouts of flu strains. Even our own Tom, the camera guy, he's like, I do not get the flu shot, but I want to get it this year because he got a bad strain of flu last year and it really put him down. So he's like, the proof is in the pudding.
To be clear, the flu is not stomach, intestines. That's not the flu.
You're not hurling, right?
No.
Okay.
The flu is a respiratory disease. So, and it causes, like, usually you know exactly when you got sick, so it's not a cold either. I mean, it doesn't come on gradually. It's like all of a sudden you feel awful.
Boom.
High fever, achiness, cough. Sometimes trouble breathing. Sometimes it affects the head as well. But it's very serious, and for some people can cause, like I said, pneumonia, hospitalizations, death, all kinds of other complications from influenza.
Now, if we get the flu shot like we're getting today, does that mean we are not going to get the flu?
Hopefully you're not going to get the flu.
Right.
No vaccine is 100% effective. And viruses, flu viruses especially, are a little bit tricky. They mutate, and so what happens is there's a group of scientists that meet and they try to predict what's going to be circulating. And they do a pretty good job.
Now, how many do circulate at any given time?
It just kind of depends on the season. So sometimes there'll only be like a couple, and sometimes there'll be several different types of influenza viruses that circulate. Typically, predominantly, it's usually 2 or 3 that kind of circulate in a season's time. So they try to protect what's going to be circulating. It's not 100%, but it's still better than doing nothing. So, which brings me to the next thing about the flu vaccine. The main thing I want people to know this year is that there are different choices in flu vaccines. So I think in the past you went to your doctor or your pharmacy and you're like, I'm here for the flu vaccine, and they give you one because there's one flu vaccine that's around that, and it's the same no matter where you go. This year there are differences. So we were talking about those different viruses. In the past, there's always been a trivalent vaccine, which has 3 strains of virus in it. So it has 2 A's and 1 B strain in it. This year and last year, there's also what we call a quadrivalent vaccine.
Oh.
So it has 2 strains of A and 2 strains of B. And that's important because since 1985, there's been 2 different kinds of B strains that circulate. And they kind of, one or the other, switch off. They usually don't both usually circulate in the same year. And in the past, the scientists have been kind of trying to predict which one to put in the vaccine. So which B vaccine or B virus is going to circulate this year. It's really, honestly, they haven't been any better than flipping a coin at predicting which B strain was going to circulate.
People accuse me of that, by the way.
So, and
this way they got them both covered?
This way they have them both covered. So they decided, this is silly. There's 2 that circulate. We're trying to predict, can we make a vaccine that has 4 strains in it and just put both of those in? So that's what the quadrivalent is. So I would really urge everyone to ask which one you're getting and to make sure you're getting that quadrivalent that has the 4 strains in it.
Now,
So,
when you're getting these shots, let's talk about something else that's pretty obvious. What about cost-wise for this? Does insurance cover this? Do you have to pay out of pocket? How does this work?
most of the time, insurance covers it, especially if you have Medicare Part B, so the red, white, and blue card. If you're over 65 and have Medicare, then it would be covered. Commercial insurances have gotten much better at covering flu shots as a preventative. So for the most part, most of the time, it is covered under insurances. There's a few cases where it's not. Some people may have a copay, but still, it's good for the money.
We have older viewers, and when you get to a certain age, you also are urged to get the pneumonia vaccine. Do you do these together usually, or how does that work?
We certainly can. So they usually are urged to get the pneumonia vaccine, and it's important to know that now over age 65, there's 2 different kinds of pneumonia vaccine that they should get, and we can do both of those. They usually get one of them, wait a year, and get the second one. So they can come in this year with this year's flu shot, get one, next year with next year's flu shot, and get the other. And that's important too for the over 65 group. There is another vaccine that's available, a flu vaccine, and it's called the high dose. And some elderly people will say, I want the old people shot, or I want the super dose. And what it is it's a trivalent, so it only has the 3 strains in it, but it's concentrated. It has 4 times the amount of influenza virus in it as the regular trivalent. And the reason that was made is that we know as people get older, their immune system doesn't work as well, so it doesn't build
Not as efficient.
It's not as efficient. And so they did some studies, and they found that this high dose concentrated trivalent was better at having antibody better immunity for those people over 65. That doesn't mean that I would necessarily recommend that for every single person over 65, because again, it's the trivalent. And we don't have any studies comparing that high dose concentrated one to the quadrivalent. Right, we have it comparing the 3 strain. So what I usually tell my people over 65 that come into the pharmacy to talk to me is that if I would anticipate you to not make a good immune response, so maybe you're undergoing chemotherapy and radiation, you have heart and lung, chronic lung diseases or chronic heart disease, something that puts you at a little higher risk where maybe we think you need that extra antibody protection, then I would use the high dose. But if you're generally healthy and good immune status over age 65, I would probably lean towards the quadrivalent. And that's my personal view. The CDC says it doesn't matter, get a flu shot. But
just get the flu shot.
Get the flu
We've
shot.
been delaying this long
Speaking
enough.
of
We
that,
gotta get this.
Get the flu
Do
shot.
I need to take my pants off, or?
I think buttocks would be good.
Okay.
Yeah.
No, but is that an option? Is it your dupa or your arm?
It is an option. It's probably not one we would choose.
Okay, but I'm just saying at doctor's office, probably.
Doctor's office, we could do it in
Okay.
the, I mean, we have done it in the pharmacy for people who needed it there for one medical reason
Right.
or another.
Okay.
But in general, I would probably say deltoid. So, and Jackie, we'll talk about yours in a minute because you're going to get a little bit different one today.
There's another
Always has to be
option.
different, you know.
Yeah,
Another option.
Just high enough.
I think so. We'll
Okay.
get there.
Now, is now the time to start asking for the flu shot?
Now is the perfect time. I like the month of October. Ideally, if we had a crystal
Now,
ball.
where are you way up
Go
there?
way up there, and I'm going to have you just
You're looking
relax
for
your
my-
arm at your side.
She's looking
I'm
for
going
the
to have
big
you.
muscle.
Yep.
You looking for the vaccination target area?
Yeah. I'm going to have you hold that sleeve, Lou, for me. If this one right here.
Oh,
There you go.
Yep, and then just relax your arm there. So ideally, if we had a crystal ball, we would vaccinate you 2 weeks before before flu starts circulating.
Okay.
But we don't really know when that is for sure. So we know that it changes every year. But usually in Iowa, it doesn't really happen before the end of October, beginning of November, and
See,
that's
kids, it doesn't hurt.
it doesn't hurt.
And is there a
And
shortage
that's
you need to
very
worry
early.
about?
Most of the time in Iowa, the flu circulates in January and February, and there is not a shortage.
There's
so
not a shortage.
And I heard a
About that.
click when you were putting. I heard
Yeah.
a click. What is that all about?
These
Put the
are-
microchip in.
yeah, so I can track you.
Good to go.
The syringes that we use are called a Vanish Point. It's a type of safety syringe, and it basically has a spring, kind of like a ballpoint pen. So at the end, when I push, it retracts the needle into the
Awesome.
barrel so
Okay.
that there's no needle
All right, so
there.
I'm good to go?
You are good to go.
Done.
All right.
See, you didn't even cry.
No, this time I didn't
Not
cry.
this year, no.
Okay.
I don't know why I didn't bring you a lollipop.
So if you walk into Medicap and just say, hey, give me the flu shot,
You can get,
please,
no,
pretty please.
yeah,
Yes,
she's off mic
absolutely.
now. Or is she wireless? Are you wireless?
I'm wireless.
You're wireless, okay.
Oh, she's got more technology
Yeah.
than you guys do.
How about that?
All right.
Raise up,
He's
hold
got
your
the-
sleeve up,
I know,
Jason.
this is.
There
You have to pick which giant muscle to use.
Now, Sherry, how much
This
is,
is a good
if
show.
someone doesn't have
Should I
insurance for
try
some reason and they don't have it covered, what does a flu shot cost generally?
If you wanted the quadrivalent, it would be $40 without insurance.
Okay.
So.
And remember,
All
some of the different places you can get it. Obviously, Medicap Pharmacy is one of the locations. And again, it's just a couple of seconds is all
Couple
it
of
takes.
seconds.
Yep.
No pain, right?
And this is available at all of the locations.
All of the locations. We have the quadrivalent, the high dose. We have the flu mist, which we're going to give to Jackie here in just a
Right, and
second.
there's a couple of different ways. You can either get the shot like Jason and I did, the traditional method, or you can have another method where if you don't particularly like needles or you want to get something a little different, this is an inhalant.
This is flu mist, which is it's a live attenuated virus. So, and it's indicated for people between the ages of 2 and 49 who are healthy. So, no chronic medical diseases, no lung disease, not pregnant, and it's actually there was some studies. And they think it possibly may have more effectiveness in kids, although they've kind of taken that back this year. They're not really sure. They're still doing studies, but certainly for kids, it's a great way to go.
So what does Jackie have to do with you?
Jackie's going to blow her nose.
Blow your nose.
Blow your nose?
This is
Okay.
the sexy part of the
I was
program.
wondering why you
Yeah.
had the tissues out here. She goes, well, I have
Yeah.
tissues here. That's what it was. So you clear your nasal passages.
Yeah, sexy.
Okay.
And then we're just going to have Jackie breathe normally.
Thank you for the close-up, Tom.
We're going to have Jackie breathe normally. We're going to squirt half up one side, half up the other. And then
So you're snorting it, basically.
actually, no.
No?
She's really, we want it to remain in the nasal passage as long as possible.
Okay.
So she's just going to breathe normally. If it starts to come out, she's going to kind of gently sniff it back
Okay.
up. But we really don't want her.
Breathing all the way in.
snort
Okay.
it, yeah.
So you
and
want it
then,
to coat the inside lining of the
right,
nasal
kind of
passage.
hang out in that
Okay.
nasal passage,
And
that's
that's where
where
it's gonna be absorbed?
replicate and work, right? And then not blow your nose for 5 to 10 minutes afterwards.
Okay.
So
No, didn't flinch. Didn't flinch at all.
Well, she's tough.
and with this one, you can sometimes
Feel
get
weird?
some mild cold-like symptoms afterwards. So maybe some runny or stuffy nose, maybe a little scratchy throat or headache, but it should be very mild.
So like every day.
Like every day. Very mild and only lasts for a day or two. Both the injection and this, they take a week or two to kind of build up and become completely effective.
Okay.
So.
So we're good to go.
You're
How
good to
about that? All right. Awesome. More information, Sherry. How do people get a hold of you? What's the easiest way?
We have several locations and all the Medicap pharmacies there. We have great pharmacists at all of our locations. Be happy to answer your questions. Check it out and see if your vaccine is covered by insurance. And their vaccines are available on a walk-in basis. You don't need an appointment. We can do ages 6 and up, so 6 years and up. So those kids that are in school and have tight schedules, you don't have to make an appointment. Just pop into the
Stop in
pharmacy.
and go.
Yeah.
Wonderful.
Wonderful. Well, thank you very
Thank
much.
you.
Thank you.